shoulder. Do I suffering from frozen shoulders? Okay, this is a question that I listen in my office every single day. I got some patients who do sports. I got other patients who are business people, sitting in the computer. Other patients work up there in the field, They, all the pretty much different jobs, working as a plumber, etc. So I'm gonna explain you with this video what frozen shoulder is. How do you know, or you can find out by yourself if you have frozen shoulder? What you should do is you have frozen shoulder. How we treat frozen shoulder as a doctor of chiropractic, okay? Frozen shoulder is number one, is a limitation of movement of your shoulder joint, because the joint capsule, okay, the joint capsule inside the shoulder get really hard and fibrotic, okay, and then you will lose especially this movement, abduction and lateral rotation, okay. You will have a lot of issue also with medial rotation. You will have limitation of movement, and then you will have pain, inflammation, of course, okay. What happened in this situation? In many cases, bad posture is one of the main situations that create frozen shoulder. Now you see people with the phone all the time, sitting in the computer for a long period of time. We're not made to do that. So that will bring frozen shoulders with time, okay? So if you are sitting in the computer like that and your shoulders are rolling, your scapula is gonna protect, it's gonna be open up, it's gonna create some muscle imbalance, okay? Your shoulder is gonna be pushing anteriorly and inferiorly all the time. That pressure with time we create muscle imbalance, like I said. It may create tendonitis, it makes, have problem with your ligaments, and all the joint space is going to irritate the whole tissue there, and then you may create frozen shoulder with time, okay? That's, I would say, the primary, what they call idiopathic. They don't know. I believe in posture have a lot to do with that. Secondary to frozen shoulder would be diabetes, the big one. People who suffer from diabetes, there is a relationship. Your bursa, which is the bursa, you got a bursa inside the joint. This is the joint here. This is the humerus, okay? Clavicle, this is the bone of the scapula right here, okay? So you got ligaments inside there who join these bones together, and then you got a little sac of oil, okay, or synovium inside there. Then when you move in the morning or you start doing exercise, you're warming up, that joint, that bursa, start pumping that oil into your bones and the muscles, all the tissue, the ligaments and the tendons, and then keep the joint healthy, and you get the nutrition through that. So then, if that bursa is dry and hard, it's going to hurt, number one, and also it's going to create issues that you won't be able to move the shoulder correctly, okay? So the capsule, the bursa inside, the ligaments get fibrotic, the tendons, you develop tendonitis. So it could be a lot of issues on there. Then we also have to think about the muscles in the front, okay? And the muscles in the back, all right? The muscles inside the scapula, the subscapularis, and then we're thinking about the rotator cuff, all right? Making all these muscles. So you got the supraspinatus, you got subscapularis, and back here, you got teres minor, infraspinatus. So you got all these muscles. You got the bursa, you have the capsule, you got the ligaments, you got the tendon, all that, and the muscles, all that could be a problem, and the whole we create frozen shoulder. What I'm trying to say, the condition is not easy to fix, okay? That's why people suffer for so much pain. And the joint, and the shoulder joint, is a joint that we need. It's a must. We need it to function every day, If you're a father or a mother, you need to carry and play with your kids. You need to use it for work. So I invite you to seek, medical care if you have frozen shoulder. I would recommend to find somebody who understands that, okay? How the doctor treat that? Your medical doctor will give you analgesic, will give you anti-inflammatory, will give you perhaps an injection, okay? And that will help with the symptoms. All right, and then you need that because pain could be really high, especially on the first 3 months, really painful. But To work on the fibrosis of the joint, the movement of the joint, you need to do exercise. You need to find somebody who understands the joint plane, the manipulations. Do a lot of exercise, perhaps a doctor of chiropractic, physical therapy. All that will help you to go back to normal. Otherwise, you will suffer for a long time, okay? So how I fix it as a doctor of chiropractic. So I'm gonna start finding subluxation, misalignment, because it's always a relationship between your nerve, between your cables and your shoulder. Every muscle have a nerve, okay? So you can't forget about that. It's always a muscle muscle spasm, muscle tendonitis. You gotta think about the muscle who feed them, the nerve who feed the muscle. So this nerve from the arms, all of them coming from your neck, okay? So I try to fix or find out if you have any issues with your neck. It's always a relationship. I find out in my 11 years as a doctor and 25 years working as a therapist that it's always a relationship with the cervical spine, okay? So we fix that, I fix that, and then I go into physio modalities. I use laser, ultrasound, I work with my hands, a special instrument to move the joint. I stretch, very important to stretch every day. Hydro, using heat and cold, and all that together with joint manipulation to break the adhesion and find out and really help the patients, okay? But you also have to be responsible for your joints. Then you have to do exercises at home, perhaps go to the gym, and all that, trimming will bring you back to normal, okay? So hopefully with this video, you got an idea what frozen shoulder is, okay? How you find out, remember, you do it active, pain, then you go passive, pain, you are positive for frozen shoulder, okay? So this is Dr. Carlos Carrasana. Follow my videos, you will learn a lot. Remember, you cannot lose with the techniques that Dr. Carrasana used. Have a good day.